28 News at 10.
First on Fox and All New tonight, statistics show that every day in the United States, 116 people die after overdosing on opioids. It's happening everywhere, big cities, small towns. And the opioid crisis was the reason a local congressman visited a low-country treatment center today. Fox 28's Robert Katniss is live in Savannah with a closer look at why he's not the only one. Robert.
Trey, as a former pharmacist, Congressman Carter says he's very passionate about this subject, especially when it hits home in his district.
We need more facilities like this.
Congressman Carter touring a Savannah treatment center today. He says there are two things fueling the opioid crisis.
First of all, how do you control the number of pills, the number of prescriptions that are out there? But also, what do you do with those 2.5 million people who are currently addicted?
He says gaining traction on the opioid crisis starts with the pharmacists and doctors.
We have to make sure that we're using the medications properly, and that means that the pharmacists, the physicians know about the uses of these medications and how to use them properly.
Clinicians say the crisis is crossing class and socioeconomic lines.
In this particular area, especially Chatham County, that there's been a rise in opioid addiction.
New season stats provided to Fox 28 show Chatham County ranks 5th in the state of illicit opioid use. That has law enforcement very busy.
It's one of the top narcotics that we are going after aggressively. And again, we're working with our state and federal partners.
Anybody can be affected by this disease.
Coming up in the 10:30 half hour, we're going to dig deeper into some of those surprising Georgia stats and hear how you or someone you know can get help. For now, reporting in Savannah, Robert Katniss, Fox 28 News at 10.
Robert, thank you. And if you think the opioids crisis doesn't affect you, consider this. The Centers for Disease Control estimates the total economic burden for prescription opioid abuse is more than $78 billion a year. That includes the cost of health care, lost productivity, addiction treatment, and the cost to the